Good afternoon, everybody. Thank you so much for attending this Writing Successful Grant Applications Part 1. Some of the information we're going to cover today will be some background information about the NIH, kind of how it's organized. We'll also discuss some of the common grant mechanisms, which you may find to be background information, but I believe that in order to write successfully, you need to really understand some of the rules, the regulations, and how the NIH is set up. So the first part of our agenda today will be focused on that. Part 1.1 is an overview of the NIH, moving into the differences between the grant and contract mechanisms. We're going to discuss some of the most common overview of some of the most common grant mechanisms that I think the audience will be interested in today. We're going to discuss how to find the mechanism that fits your idea. We're going to look at assessing the competition, developing your idea. Definitely going to go over some general rules and regulations, because it would be a shame to put in so much time writing a good grant, but to have messed up one small rule and have it sent back to you. We're going to determine many grant applications require pre-approval. You just can't submit something on your without asking permission first. So we're going to look at how to determine if pre-approval is needed and how to write that letter to get the pre-approval that you require. Then we're going to go into the outline of an NIH application. Part 2 will be more focused on the parts of the NIH application and writing the actual body of the research plan. I've provided you a quick overview of the organization of the Department of Health and Human Services. The NIH is one block underneath this org chart. What's nice to note is that even though this is focused on NIH applications, many of these groups use the same rules and regulations. For example, the AHRQ, or often referred to as the Agency for Healthcare and Quality Research, CMS, or the Center for Medicaid and Medicare Services, and SAMHSA, the Substance Abuse and Mental Health Services Administration, all use very similar forms, very similar rules and regulations. So it's important to note, even though we're focused on the NIH today, I hope a lot of this will translate into other grants you may want to write for other institutes. The NIH itself is made up of about 25 institutes or centers. The sixth one on the list is the NHLBI, or the National Heart, Lung, and Blood Institute, and you'll probably find today that I reference that a lot. One, because it's the one I'm most familiar with, and one, because I believe it's probably what the audience is most interested in. But again, many of the institutes and centers within the NIH follow very, very similar rules and regulations. So even though I may speak often to the NHLBI, it should be translatable to most of these groups. Also, it's important to know that if you have an idea and you want to submit it to an institute such as the NHLBI, and they can't or won't accept your idea, you can go to some other institutes. For example, the National Institute of Aging is another popular one that physicians often apply to, as well as the National Institute of Neurological Disorders and Stroke. So don't sell yourself short if you run into a wall where a specific institute won't accept your idea or won't accept your application. Keep trying and talk to some other institutes. I've also provided a quick table of some acronyms. I'll try to be careful with my acronyms and not assume you guys know them all, but I know that will be difficult, so I have this slide here for you to reference in case I have an acronym that I spit out and don't define for you. Any acronym in this presentation, as Part 1 as well as Part 2, should also be on this list for you to reference. I want to discuss today the differences between grants and contracts. Although this is a grant writing lecture, contracts are also very popular mechanisms of award and also follow very similar rules and regulations. So I just want to point out the difference. I've actually helped investigators write proposals and then halfway through realize that they think they're applying for a grant and they're really applying for a contract and they didn't know it. So I just want to point out some of the differences, and this is a quick overview. Grants can be solicited or unsolicited, and contracts are almost always, 99.9% of the time, solicited. When I say that, I mean the NIH asks you for a proposal. Solicited grants can be in the form of program announcements, or PAs, or RFAs, which are requests for application. And unsolicited, which is very popular here, is the old-fashioned investigator-initiated grant, where Dr. So-and-so has an idea, and he provides an application to the NIH. Contracts are typically solicited through RFPs, or requests for proposals, or broad agency announcements, BAAs. So this is a snapshot, but on the next couple of slides, I'm actually going to go into some of the details that show the differences between the two mechanisms. I already mentioned the type of solicitation. Grants can be solicited through RFAs or PAs. Something to mention about RFAs and PAs. RFAs are usually one-time submissions. The NIH has something they are interested in. They publish an RFA, and it's a one deadline, one-time shot. You apply for it, and the deadline goes by, and it's closed. PAs are a little bit different. They're usually on rotating schedules, and it just means that the institute or center sponsoring that particular PA has a particular interest, that they've set aside funds to fund specific types of projects over the next, say, 3 years, and so that PA will be a revolving announcement that is there for you to apply several times, whereas an RFA is a one-time shot. Contracts, on the other hand, or RFPs, are also one-time shots. They come and they go, and you don't get a chance to, usually, you don't get a chance to apply for them again. Some key words here is grants. You apply for a grant, hence RFA, request for application. But a contract, it comes with very specific rules and a specific scope of work, and you respond to that scope of work and provide a proposal, which is where the RFP, or request for proposal, comes from. The type of award mechanism. Grants have many different type of award mechanisms that start with many different letters, and we'll get into that in just a second. U, R, K, P, T, it's quite an alphabet. Contracts, on the other hand, always start with N. If you see a grant number, a number on your contract or on your paperwork, and the number starts with an N, it's a contract. Always, always, always. Due dates. RFAs and PA due dates are set by the NIH. For first-time investigator-initiated grants, the due dates are always February 1st, June 1st, and October 1st. If you're revising an application, you've turned in an application and it's rejected, or the score is not good enough, and you want to revise it, they accept the revised applications on March 1st, July 1st, and November 1st. Important to note is you can revise an application. You can submit an application up to 3 times, which is the original in 2 revisions. For a contract, the NIH typically determines the due date 60 to 90 days after the RFP is released is typically when it's due. The length of the proposal. For grants, there is a research plan section of the application, which we will talk about a little bit today and a lot in part 2. Sections A through D of the research plan are always limited, well, 90% of the time they're limited to 25 pages unless the instructions say otherwise. Sections E through J are unlimited in length, and the administrative pieces of a grant, which we will also talk about a little bit today, but a lot in part 2, are unlimited except for the bio sketches, which are always 4 pages each. For contracts, the technical proposal page length is always set by the NIH. In my experience, it's typically 30 to 50 pages in length, but it's also been unlimited at times. You just need to read your directions. And for a contract, it also requires that you submit a separate business proposal, which just is all your administrative documents, and those are typically always unlimited in length. study design. For grants, typically, or the PI provides the concept and the study design behind the idea, whereas contracts, again, you're responding to a very specific RFP that's going to outline the actual services the NIH wants. So the NIH is responsible for the design. The review process. We'll talk a lot about the review process in Part 2 for grants, but in a nutshell, a grant that's received by the NIH is reviewed by the CSR, Center for Scientific Review, or it can be reviewed at the institute center level. It's given a score of 100 to 500, 100 being the best, 500 being the worst. After it's scored, the PI will receive a summary statement outlining the reviewer's comments. Contracts are judged a little bit differently. You have to read the instructions, but they are scored on some sort of point system. And you don't automatically receive a summary statement or a letter that tells you the reviewer's comments. You typically have to request that, but if you do request it, you will get it. I want to discuss today some common grant mechanisms. First of all, let's discuss what a mechanism is. A mechanism is simply the way the NIH funds a grant. A mechanism consists of a letter and a number. For example, RO1, K08, T32, P01, so forth. The best way I can think to describe this is that the letter indicates the mechanism's family. So everybody under an R is under a specific family, and the number indicates the kind of family member you are. And I'll actually get into that in the next slide. And the term family is really my term, just to explain it. It's certainly not an official NIH term. But for grant mechanisms, families can include the F family, which are fellowship programs, K, grants, which are research career development programs, Ns, we already discussed, are always contracts, Ps are program project grants, Rs are research projects, T, training programs, and U, cooperative agreements. Now this is just, I think what I have 7 there, 7 out of pages of letters for you to look at. And if you're really interested in reading about all of them and what they do, there's a link, and for a complete list, you can refer to the activity codes, organization codes, and definitions used in extramural programs document, which is a published document by the NIH that explains all that. But I put these up here because I think they're kind of the most popular ones, and I think they're the ones the audience would be the most interested in. In yellow, I have highlighted the research projects because that's what we're going to really discuss today. So family members within the research project mechanism would include an RO1, a research project, an RO3, a small research grant, an R21, exploratory developmental grants, an R34, a clinical trial planning grant, and the R43 and the R44 are small business grants. Again, there is quite a list of them that expands over several pages that you can read about if you click on that link at the bottom of the slide. But today I'm going to discuss the first 4 because, again, I think that's what the audience might be more interested in, and those are the kind of more popular ones that I see come through my office. So let's start out talking about the RO1. It's probably the oldest and most popular grant mechanism used by the NIH. It's certainly one of the most popular grant mechanisms used here at Duke. It's designed to support a discrete, specified, circumscribed project to be performed by the named investigator in an area representing his or her specific interests and competencies based on the mission of the NIH. Key is that the PI should be senior enough to be able to conduct the research independently. The amount of funding an RO1 supports may vary from year to year. And any RO1s over $500,000 direct cost in any given year, you must have the NIH's pre-approval or permission to submit the grant beforehand. And there's a link to more rules and regulations at the bottom of the slide that'll tell you about RO1s. An RO3 is a small research grant. It's something you would probably do before the RO1 stage to help plan or justify the need for your RO1. So it supports preliminary short-term projects, can support pilot data or feasibility studies. It can also support the secondary analysis of existing data, provides support for up to 2 years in the amount of $500,000 direct costs per year. It's non-renewable, so once it's done, you're done. You don't get any more chance to extend that grant. Not all institutes and centers accept the RO3, so check with, if you're interested in going through a specific institute or center, you need to check with them or go on their website to make sure they'll even accept these type of grants. And again, at the bottom of the slide, there's a link that'll provide some more details. The R34 is also quite popular as it provides some funds for planning a large clinical trial, a large phase 3 clinical trial. So it provides establishment of the research team to help establish data management tools, your case report form, maybe developing your database. It provides support to finish your protocol and your manual procedures. It's the kind of things you would do during the planning phase of a clinical trial is what the R34 would support. It's not designed for the collection of preliminary data or the conduct of pilot studies. It provides support for only 1 year in the amount of up to $100,000 direct cost. And not all institutes and centers accept this. And I mentioned that I do a lot of work with the NHLBI, and the last time I checked, and I get asked about this grant mechanism all the time. The last time I checked, which was probably about a month ago, the NHLBI did not accept an R34. But the NIA does. So that's when I was saying just because you hit a stumbling block or a brick wall with one institute, it's also a possibility that you could go and get your idea funded by another institute. The R21 is the exploratory or developmental grant, and it encourages new exploratory and developmental research projects by providing support in the early stages of development. It's high risk and high impact, so it may be a very novel idea that's very risky, but if successful would benefit public health very greatly. Preliminary data is not required for an R21. It provides support for up to 2 years in the amount of $275,000 direct cost, $100,000 in year 1 and $175,000 in year 2. Again, not all institutes accept this, so please check with your institute and center of choice. And on the bottom there's a link that will provide you some more information. So finding the mechanism to fit your idea. So if you have an idea, how do you know where to go? How do you know to apply for an RO1, an RO3, or R34? Or do you look on that long list of that long document of pages and pages of mechanisms and go for one of those? Well, first you should probably check with your institute and center website and see a list of mechanisms they support. Most of the institutes and centers have very, very good websites that'll explain and outline exactly what they support. Also contact your project program officer within your institute and center of your choice, and he or she can help you guide towards the right mechanism. Also, it's a good idea to send a one-page synopsis of your idea to the program officer to help that person determine whether what mechanism is right for you. You can proactively search the NIH website for any open RFAs, PAs, or RFPs. So maybe you don't have to independently submit an independent grant, but there might be an RFA or an RFP out there that fits your idea. You can also sign up for the NIH listserv, which notifies you every Friday of new opportunities that the NIH is funding. So I want to take a second to show you that listserv. The website's at the bottom of the slide. But if you sign up for this, you'll get updates of all the new RFPs, RFAs, and PAs that are released by the NIH. It'll also provide you any updates on not only opportunities, but new rules and regulations that the NIH publishes. So weekly, I've signed up for this. I get notices of new rules and regulations that the NIH has, so that's also very helpful. If you go to the main NIH website, you'll see a link to grant and funding opportunities. This will also provide you any of the past funding opportunities that they've published. So let's say you sign up for listserv today, your first email that you would receive would be for Friday, but you would miss anything that happened to come out in the last month or so, in fact the last year, because this is it archives a lot of the older stuff. So I would always encourage you to also check the grants and funding opportunities link, and it'll give you a list of all the active and closed, actually, PAs and RFAs and such. You can also go to your individual institute and center. So for example, if I'm interested in knowing what the NHLBI is specifically funding, because I don't want to go through and read web pages and web pages of open RFAs, I can click on Institute Centers and Offices. It'll give me a list of the 20+ institutes and centers, and I can click on the NHLBI, and it'll give me the funding opportunities, and it'll give me a list of everything that they are funding. And every single website for all the institutes and centers have a link to the funding opportunities. Sometimes it may be at the top of the website, sometimes it's to the left, sometimes it's to the right, but it's usually very clear where to find your funding opportunities for each institute and center. So I just used the NHLBI as an example today. Assessing the competition. Well, you need to know who else is out there doing research similar to your idea. Of course, it's a good idea to search the literature. The databases like PubMed and Medline should be helpful. There's also a lot of databases online that can tell you who's doing what currently. For example, the CRISP database, which is the Computer Retrieval of Information on Scientific Projects, is a database run out of the NIH that'll show you all the funded research. Community of Science and National Science Foundation also have nice databases you can look at to see who's doing what research and what's being funded. I want to take a second, though, to look at the CRISP database. If you go to the web link at the bottom of the slide, this page will appear. And basically what this does is it provides all the funded research, not only by the NIH, even though it's run out of the NIH, it also includes the Substance Abuse and Mental Health Services Administration, the Health Resources and Services Administration, the FDA, Food and Drug Administration, Centers for Disease Control and Prevention, and the Agency for Healthcare and Quality Research. So it's more than just the NIH. If you select Go to CRISP Query Form, you can enter search terms, and you can sort by specific institutes, you can sort by funding years. If you actually know the PI name, you could put that in there. But you can, by filling out this form and doing different types of searches, you will get a list of all the projects that are funded in your area of interest, as well as that person's abstract. So the abstracts are about a half a page, the PI name and the institute he or she comes from, as well as the start and end dates. So any funding by the NIH is on here. Developing your idea. Before you go forward, it's really, really important to know your institute and center's goals or high priority areas. And if you go to each of the institute and center's websites, usually most of them, it's pretty easy to find their strategic goals or their, fiscal year goals, something like that, that'll tell you what they're interested in funding and what they've set aside money for. So right away you can tell whether your idea fits in with what they are interested in. Sending a one-page synopsis to the project officer that includes your specific aims and your hypothesis is a good idea. He or she can help you develop that. Of course, requesting feedback from your project officer is a must. You would want to get feedback from your colleagues, and as you continue to develop your grant, even consider holding a mock review session of several of your peers where they would actually read your application and score it. Get feedback from administrators. That's really important. You have to remember to not always write for the specialist, but always write, also write for the layperson. Make sure your administrators understand your project and can help you out with it. And keep your idea focused. Don't propose too much. It's important to be committed. I would advise anybody to allow at least 6 months to complete an application. Setting aside regularly scheduled time to work on the application, setting aside uninterrupted office time is a very, very good idea. Contact your co-investigators in your team early on. Talk with your grant administrator early. Let them know that the grant's coming and what kind of support you'll need from them. And meet weekly with your team. I can't stress commitment enough, because if your grant is weak and it gets submitted and it gets turned down and you resubmit, it's a very high chance that the study section you'll be resubmitting your grant to will be many of the same peer reviewers, and they will remember you. They will remember sloppy work. So there's a nasty rumor going around that it's absolutely impossible to get an RO1 funded on the first go-around. I won't deny that it's not easy. It's a difficult task to do, but make your application as solid as you can. Don't just put something in just for the sake of wanting to get comments back. Make it as good as it can be, because the reviewers will remember your application the second and third time around. I've mentioned the project officer quite a lot throughout this presentation, and I want to make sure everybody understands the importance of this role. The project officer is a representative within each institute and center who has experience in the scientific and technical goals within their institute and center. This person can help you with your pre-application process by answering a lot of questions for you. For example, will the specific institute and center have a specific interest in your application? Does that institute and center have the funds available to support your idea? And should you consider getting your application assigned to more than one institute? Sometimes institutes will partner on an idea. For example, I mentioned the NIA, the National Institutes of Aging, and the NHLBI may both contribute funds to your idea, and the project officer can help you work through a lot of those questions. So make that person your friend. Make that somebody you get to know very well. It's good to probably first contact that person via email with a attachment of your idea, and then you can set up a time for a conference call. And I would advise that you have some of your co-investigators and even maybe your administrator, your grants administrator, on that call. Excuse me. It's also important to know the general rules and regulations. I mentioned it would be awful sad to have a top-notch application return just because you had 26 pages in your research plan instead of 25. So I'm going to go through some of the rules and regulations that will probably seem silly but are very, very important. The first bullet provides a detailed listing of all those rules and regulations on that link. But I'm going to highlight today just some of the very simple ones that you need to memorize. For example, the title of your project is limited to 81 characters. That includes all spaces. Your font must be Arial, Helvetica, Palantino, or Linotype, or Georgia. Times New Roman is very, very popular, but just recently the NIH has changed it, and they won't accept Times New Roman anymore. So please keep that in mind. 11-point font or larger is acceptable. Font sizes in figures and tables can be smaller. Just be aware that they need to be readable. Type density, including spaces, must be no more than 15 characters per inch. Also, there may be no more than 6 lines per inch. The margins must be half-inch margins on both the top, bottom, right, and left. The entire grant application should be numbered consecutively. Even letters of support, anything in the application aside from appendices ought to start with page 1 and be numbered consecutively throughout. The PI's name should be included on the top right-hand corner of every page, including letters of support. And sections A through D of the research plan cannot exceed 25 pages. Again, I can't stress enough, these rules are important because the NIH receives almost 80,000 applications per year. Here's a picture of just one of the rooms at the NIH, one out of many rooms where applications are received. And there's somebody here who goes through and checks them all to make sure those rules are followed. So it would be sad to have this person return your application. You have a winning idea that is certain to get a score in the 100s and to have it turned back because you used 12-point font Times New Roman would be quite a shame. So beware of this lady. I mentioned that some grants will require pre-approval before you can actually submit the grants to the NIH, and any grant exceeding $500,000 direct cost in any given year must have the specific institutes or centers pre-approval for you to submit that application. To gain pre-approval, the PI must send a letter to the institute and center. That letter is due at the NIH no later than 6 weeks prior to the application date. That's key. And in fact, I would really, really advise not waiting 6 weeks, because what happens is that you get your permission to submit a day or two before the application's due. And that's just no fun to have worked on an application and realize that you don't have permission to submit, or have not worked on an application because you're waiting, and a day or two you get permission. Check with each institute and center's program officer for specific rules within that institute and center, because sometimes we're going to discuss today some of the NHLBI specific rules about these pre-approval letters, but some of the institutes and centers do have slightly different rules, so that's why I encourage you, if you're not submitting to the NHLBI, to definitely check with the individual program officers within other institutes and centers. If pre-approval is granted, the institute and center will provide a letter to the PI stating that your application will be accepted and on what date it will be accepted on. The NIH's letter must be included with the application at the time of submission. If it's not included, in other words, you don't put it at the top of your grant, or if you don't get pre-approval, your grant will be sent back to you. I mentioned that the NHLBI has some specific rules when it comes to submitting these pre-approval letters. There's a web link you can look for here, but I'm going to try to cover some of the main ones for you. The letter should be approximately 5 to 6 pages, single-spaced. Should be sent to the appropriate extramural program division director, and again, if you click on that website, it'll help you, guide you through that process of who it should go to. The letter should include a preliminary budget broken down by direct and total cost in like a table type format, or easy readable table type format. It doesn't have to include personnel and detailed, budgets, but it should at least have a line for direct cost, indirect cost, and total. And once you submit that letter with that budget, you're committed to that budget. So make sure you're comfortable enough with your idea and your plan that you're not going to get the letter back and decide that you need to enroll twice as many patients, because you will be stuck to that budget, or stuck with that budget. Pre-approval letters that fall between $500,000 per year and what the NHLBI calls the PPG cap, or Program Project Grant cap, of $1.5 million a year in fiscal year 06, must be submitted and received at the NIH 6 weeks prior to the application due date. If your budget or letter includes a budget higher than the PPG cap, or higher than $1.5 million, then the letters are only accepted once a year on November 15th. So that's key to understand. I mean, if you have a budget that's going to exceed the PPG cap, and you submit it on November 15th and they turn you down, then you have to wait a year before submitting it again. Whereas anything between $500,000 and $1.5 million, you can submit 3 times a year, but that date is 6 weeks before February 1st, June 1st, and October 1st. For the NHLBI specifically, the body of letters should include the targeted application date when you'd like to submit the application. Should state the title of the study. Should include the research question you plan or questions you plan to answer. Should include the sample size and total budget up front. Right in that first paragraph, it's good to tell them what that budget is going to be. Should describe the rationale and importance for the research question. It should summarize the study design. It should include information such as sample size, power calculations, methods, your primary and secondary outcomes, key measurements, so on and so forth. It should describe the organizational structure of your project. So if you have subcontractors or key consultants, provide a brief idea of how your project's going to be organized and who the main players are. Should include information on the proportions of women and minorities that you expect to recruit for your project. Should include plans for a monitoring plan, and it should describe plans for how you're going to disseminate the results. Outline of a grant application. So a grant application always follows, well, I won't say always because there are always exceptions to that rule, but most of the time a grant application will follow this specific outline. A face page, your description, performance sites, key personnel, and other significant contributors. This is often called the abstract page, but that's truly just our term that we call it, but it's actually called description, performance site, key personnel, and other significant contributors page. But this is where you put your abstract. It's going to include a table of contents, a detailed budget for year 1 only, a budget for the entire period support. So if your grant application has more than 1 year, years 2 through whatever would not need detailed budgets. A detailed budget. It will include budget justifications, but your bio sketches for key personnel. Did this just turn off? Can you guys hear me? I didn't touch anything. It says low battery. You want me to talk to this? I'm almost done. Sorry, it said I got a message that says low battery. Can you guys hear me okay now? Okay. It'll include your budget justifications, your bio sketches for key personnel, a resources page, which will describe your facilities and your environment, your research plan, sections A through J, and I have that highlighted in yellow because I'm going to talk a lot about that, a little about that today, but a lot about that on Wednesday or in part 2. It's going to include your checklist and your personal data page. I've outlined here for you what I consider to be kind of the administrative documents and what you can get your grants administrator or your Office of Grant Support to help you with. And the research plan is the science, is the study design. So the research plan I want to highlight real quick. It's going to include if you are revising your research plan, so you've submitted a grant and it was not accepted, and you have revised it and want to resubmit it, you need to include an introduction to the revised application, which is a 3-page introduction allowing you to respond to the summary statement, to the peer reviewer's comments. Section A is then going to be your specific aims, which is typically about a page. Section B and C, B is the background and significance, C is preliminary data. B is usually 2 to 3 pages, Section C is about 6. These are suggested page lengths, by the way. The research design and methods would be the rest of the 25 pages because A through D cannot exceed 25 pages. Section E is human subjects, so sections E through J don't have a page length on them. I've highlighted sections A through E because in Part 2 we're going to discuss each of the items that are supposed to be within those sections, but we're not going to focus on sections F through J in this session. So looking ahead at Part 2, we're going to talk about completing the administrative documents. We're going to focus on writing the research plan and the pieces and parts that go in sections A through E. We're going to look at some grantsmanship tips, and we're going to look at the review process. So once you have submitted your application and you've done the best possible job, where does it go from there? And we're going to discuss how that works, the review process, the scoring process, and what criteria the reviewers are going to judge your application on. And that's it for today. If there are any questions, I'm happy to answer them now. I've also included my contact information up there, so if you want to email me or call me with questions, I'm happy to answer them.